All right, it's 9:02, so let's go ahead and get started. Thanks so much for joining today. This is a webinar about how to build a robust patient engagement strategy, specifically talking about the dynamic duo of Azara Patient Outreach and the CareMessage platform for patient engagement and activation. So thank you so much for joining. We're looking forward to a robust conversation. My name is Nora Marsh. I'm the Director of Marketing at CareMessage, and I will let the CareMessage team members introduce themselves and hand it over to some introductions from our guest presenters today. Tracy, do you want to
Sure.
Go ahead and introduce yourself?
Hi, glad to be here. I am Tracy Angelosi. I'm the Chief Medical Officer at CareMessage.
Hey, everybody. I am Stephen Bivens, a Senior Customer Success Manager here at CareMessage.
Hi, everyone. My name is Orit Mohammed. I'm a Principal Product Manager here at CareMessage.
And then in terms of our guest presenters, we have Alkida and Randy and Sam. Do you guys want to say hi quickly?
Sure. Hi, everybody. My name is Alkida Kasapi. I am the Population Health Manager at Greater Rosendale Medical and Dental Center in Boston, Massachusetts.
Hello, I'm Randy Carlisle, the Chief Quality Officer with Care South Carolina.
Hi, I'm Sam Barr, Solutions Engineer at Azara Healthcare.
Great, thanks, Sam. So that's some of the people we have on the line today. We have others from CareMessage, and I believe also from Azara. In case there are specific questions, they may chime in, but that's most of the team that we'll have talking today. And what we're going to do is go over an overview of the CareMessage platform and our partnership with Azara Healthcare. Then we'll talk a little bit more specifically about how to implement a robust patient engagement strategy with CareMessage. Then we'll go into customer spotlights from Greater Rosendale Medical and Dental Center and Care South Carolina. And then finally, features overview and pricing. So hopefully that will cover what you're looking to learn today, but always feel free to drop a question in the chat or follow up with us afterwards if there's anything that you wanted to learn that we don't cover. So a little bit about CareMessage. You may know CareMessage already. We are a nonprofit organization, the largest patient activation engine for underserved populations in the United States. Our technology platform helps safety net organizations. We work mostly with free and charitable clinics and federally qualified health centers to fulfill the needs of their patient populations. And our overall vision is a world where all people, regardless of income or background, achieve equitable health outcomes. So we'll talk a little bit today about how our platform is designed to work through our customers to do that. And CareMessage has been working with Azara Healthcare, which has a complementary mission since May of 2020. We have a strategic partnership, and part of that partnership is the Azara Patient Outreach tool, which is powered by CareMessage technology, which you may or may not already be using Azara Patient Outreach. It's a messaging solution that helps health centers that are using Azara to address population health needs, fill gaps in care, and demonstrate improved health outcomes. So right now, CareMessage and Azara reach 55 joint health center customers, which represents 1.7 million patients-ish. But we are always growing that partnership and looking to reach more patients, as is our mission, through this partnership and also through our platform. And so I mentioned that you may or may not be already using Azara Patient Outreach. I know that we have some primary care association representatives on the line, potentially some centers who are using Azara Patient Outreach already or may have just started, but it's designed to conduct targeted automated outreach programs using patient information within Azara drives. So using that data, health centers can expand the number of patients that they're reaching, identify gaps in care or things that are about to be due, like immunizations or well child visits. And then they can, health centers can initiate automated patient outreach that moves patients in and out on an ongoing basis. We say set it and forget it. So patients can be enrolled, and then patients come in as they are identified as having that care gap or that soon to be due item. And then the results and efficacy is tracked within Azara drives. So it's an awesome tool to automate patient engagement and meet really discrete needs in terms of communication and closing care gaps. So you may or may not already know, these are the available APO programs. There are additional programs being added on an ongoing basis, but focus on cancer screening, management of chronic disease, pediatric needs, preventive visits, getting patients into care, and then obviously COVID needs. To increase your understanding of how CareMessage can help you implement a more robust patient engagement strategy and automate more of your needs in a different way from APL, but in a way that hopefully makes life easier. And the way we do that is by helping health centers to improve patient access and communication, helping you to drive bottom line efficiency, and then finally helping to maximize clinical quality and funding opportunities. So these are the three buckets that we will dive into in terms of the features and benefits that CareMessage can offer health centers. So the first one being improved patient access and communication. And this is really the value that you get from the ability to increase the messaging and reach that you have to patients. So our customers use CareMessage to efficiently message large groups of patients, which may be because they're an office closure, an announcement, say a physician leaving the practice or something like that. It's also a good way to get large groups of inactive or newly assigned patients into care by sending a message to a large group that, say, hasn't been in for care in over a year, but was in the office prior to that. We also have many customers who send out community resources like links to food pantries or information about resources that are going to be available, or public health and emergency messaging. We had a huge spike in usage during COVID, and we see spikes when there's a hurricane in Florida or other, unfortunate emergencies, because text messaging is a great way to get any message out to a large group of patients very quickly. Many of our customers also use CareMessage to have direct one-to-one conversations with patients. So following up with a specific patient, oftentimes we have care coordinators who may track down hard to reach patients via their preferred method of communication and find that actually time is much more efficiently used, and conversations can be tracked much more effectively and automatically with those one-to-one conversations happening via text. So essentially it's a way to deliver messages to 1 or 100,000 patients within minutes, and then view metrics on that messaging. So there is a data point here that we did have a health center that did an outreach to inactive patients and got a 20% response rate. So just getting patients into care and helping to improve their access is a huge part of what CareMessage can do. We also help our customers to drive efficiency. And I think the kind of low-hanging fruit with this is appointment reminders. We can help increase efficiency, decrease no-shows. We oftentimes see no-show rates reduced by half with customers coming in and implementing CareMessage where they hadn't had appointment reminders before. But I almost hate to call them appointment reminders because our appointment reminders really work harder by providing patients with lots of direction and necessary information, which I'll show on a couple additional slides here. We can also work to automate follow-up with patients who did attend their appointments and ask them to fill out a patient satisfaction survey, or if a patient no-showed on an appointment, we can send an automated communication that will gather information in order for the staff to be able to more efficiently reschedule them. And one of the important things I think about our appointment reminders is that because CareMessage has a flat per patient pricing model, you can send as many messages regarding an appointment to a patient as you want to. So we hear sometimes from customers who are messaging patients via their EHR that, oh, we limit it to, 1 or 2 reminders per appointment because we pay per appointment reminder, but with CareMessage, you don't. So we really, because we're mission driven, we want you to use the platform as much as possible to improve health outcomes for your patients. We want you to send as many messages as you need to in order to communicate with your patients. And this is, I know, a little flow chart thing kind of starts to make your eyes cross, but basically showing how data comes in from the EHR, patient and appointment data, and is received by CareMessage. We integrate with multiple EHRs, which we'll talk about again later. And then text reminders are sent to patients when they respond yes or no. That data is sent back to the EHR and also can feed into daily automated reports, which our customers like to use oftentimes for a huddle. And if the patient responds yes, they get some additional appointment details. Or if they respond no, as I mentioned, we can feed them into a messaging stream to start to gather information to get them into a different appointment date or time. Then after they're scheduled, if they respond yes, after their scheduled appointment date and time passes, we can query to determine whether that patient did in fact attend the appointment. And if they did, they can receive a satisfaction survey. If they did not, then they can receive a recall message. So we think that this message stream is really additive to help your team be able to just be more efficient with making sure that patients get into care and automating some of the necessary follow-up tasks around appointments. And one thing that is important to know about our appointment reminders is that the content is customizable. So you can send a different appointment reminder for behavioral health appointments versus maternal appointments versus, well child visits, and the content can be different for each. And we can also include smart tags in our appointment reminders that offer more information to the patient. So if we need to tell them a specific clinic address or ask them to bring medications or ID or wear a mask or details of their prescriptions, we can include all of that information in the appointment reminder or in multiple appointment reminders. And we can also include personalized patient information like the link for a telehealth appointment or their estimated copay amount. So really the appointment reminders can do a lot in terms of communicating with patients and automating some of the tasks that your staff have to do around appointments. And then finally, the third sort of bucket that I introduced at the beginning is maximizing clinical quality and funding opportunities. So this is really when our customers use CareMessage to the fullest extent of its capabilities. They can do much more sophisticated work to maximize the quality of the care that their patients are getting and make their and improve their own metrics. So we know that clinical referrals is an area where health centers spend a great deal of time in managing, and we do have automated text workflows to help centers manage clinical referrals and get more referrals closed. We also have capabilities for centers to use pre-created surveys for patient satisfaction or for screening for patient needs, or create their own surveys to be able to fill some of the metrics that they are taking a look at. And I think we'll hear a little bit more about that in the customer presentations. And then finally, we have several multi-week health education programs. So the APO programs are much more sort of tightly created to meet specific needs and close specific care gaps. The additional health education programs that the full CareMessage platform offers are longer and branching, personalized streams of communication. So Dr. Angelosi will go into that a little bit, but before she does that, I'm going to focus for 1 minute on referrals. You see over here, the data point on this slide indicates a 30% response rate, which is what we saw with an FQHC in Florida that was trying to close a lot of open referrals. And just by asking one question of, whether your appointment is scheduled or not, they were able to get a really high response rate and save a lot of work that they would have been doing in calling patients. And so this slide shows a little bit about the referral cycle. We know that it varies by health center, but usually, you have a clinician submitting a request for a referral, and then the patient is notified. Ideally, they make an appointment, and the health center would know. You get the documentation from the specialist and be able to close the referral. And we know that oftentimes it does not go like this. So we can create automated messaging streams that supports your referral closure process and sends reminders to patients to be able to gather data and make your referrals team more efficient. So that's something that we're super excited about. And I will hand it over to Dr. Angelosi now to talk a little bit more about our health education programs.
Sure. One of our most powerful modules is called programs, and we have a patented tool that we use to build out programs. And in their most basic form, a program is simply a set of sequential messages. The power comes from the fact that programs can be both bidirectional and incorporate branching logic. So with branching logic, we can take multiple data points from the patient profile, like age, gender, race, ethnicity, and then create multiple messaging branches that deliver different personalized content for each group. And because messaging is bidirectional, we can embed survey type questions into that campaign and then use the patient's answers to further segment the downstream messages that they receive. So if you just take a really simple example of a cervical cancer screening message and all of the variables that go into that, you know that the recommended frequency of screening varies by age. Women under age 26 are still eligible for the HPV vaccine. Older women have a common misconception that they no longer need PAPs after menopause. And even the risk of cervical cancer is different by race and ethnicity, as are cultural norms about getting screened. So rather than send the same generic message about screening to all women, we can tailor the messaging around all of those demographics and patient responses. And then most exciting to me is that we craft messages based on theories of behavior change. So research shows us that whether or not a patient is going to follow through on your health-related recommendation depends on their perceptions, particularly about these 4 things: about whether they believe they're actually susceptible to the disease or the complication that you're talking about, whether they believe the consequences of not taking action are severe, if they believe that whatever you're recommending for them, recommended action is actually going to be effective in reducing their risk, and if they have confidence in their ability to follow through, which is all about overcoming real and structural barriers like transportation or cost, but it's also a lot about internal or perceived barriers and things like discomfort or embarrassment or time or hassle factor. So we can create a campaign that addresses all of those factors and perceptions, or we can sprinkle in survey questions related to those 4 beliefs, and then deliver messaging that is specifically tailored to a given patient's perception and their readiness to act. So initially, we used programs to build the programs feature to build out health education programs that are designed to both educate patients and prompt behavior change. So in things like chronic conditions like diabetes and hypertension, a patient could receive 2 or 3 messages a week for up to 6 months for some of the more chronic conditions like diabetes and hypertension. But you can also see there that we go into goal setting and nutrition and smoking cessation and stress management. Another very popular use of programs is to build surveys. And most commonly, we see that used for patient satisfaction surveys, but we have health centers also doing social determinants of health surveys and delivering community-based resources automatically through those surveys. We have engagement campaigns that touch on different topics related to healthy behaviors and preventive care throughout the year. And we have gaps in care programs related to cancer screenings. We're also really happy to work with customers on custom programs. We have some health centers using this feature to screen for depression and anxiety, and to use it for remote patient monitoring to gather weight and blood pressure readings from patients. And then because of our cool partnership with Azara, users of Azara can pull a patient detail list from drives, either from a clinical quality measure or from a population registry, and export that list directly into CareMessage. So when they click export patient list, you're prompted to give a file name for that. And the file is then automatically sent over to CareMessage via SFTP. And that makes that patient group available in CareMessage for a targeted or a customized campaign. Turn it over to you, Steve.
Awesome. Thank you so much, Tracy. We just want to touch on some of the integration solutions. And with health centers, we always encourage to automate as many high frequency and high volume actions as possible, really to ultimately free up staff members' times. So these needs for automation and workforce load reduction led us to our integration solutions, such as ours with Azara. But as you can see, we can integrate with several electronic medical record platforms with different types of integrations on the right, and of course, Azara on the left. But our integrations are mainly fueled through these three different types of integration. Just really quickly highlighting some brief differences. The HL7, our health level 7 integrations, are primarily used with our appointment reminder integrations. These can auto-create patient profiles within CareMessage, their corresponding appointments, send those reminder messages that we've been talking about, all without having to leave your EMR. These integrations are bidirectional, meaning we can send RSVPs back to your EMR as well based on yes and no responses. Next up on the list is our SFTP integration, our secure file transfer protocol. And these allow you to send us secure files with your list of patients, their demographic info, their appointment data, which we can automatically process then in CareMessage. So we're also rolling out the ability to use SFTPs to integrate with a few other features, such as group outreach messaging, and even what Nora was showing a little bit with our referrals feature as well. This integration allows you to seamlessly send us your patient and messaging data and information without having to manually upload anything in the CareMessage file center. And last, but certainly not least, especially applicable for today, are our API integrations, our application programming interface, which are also bidirectional integrations that automatically create patient profiles, appointments, outreach campaign programs, and can send messages without you, again, ever having to leave your EMR or your PHM. API is especially important with Azara drives, and more specifically through Azara patient outreach, while some of our other integration solutions, as mentioned above, can automate appointment reminders. Others, like Azara Patient Outreach, or APO for short, can help support messaging for preventative care and health equity by taking advantage of group messaging, gaps in care workflows, and more with very minimal workforce demands. As we saw a few slides back, Azara Patient Outreach can seamlessly create campaigns and programs around cancer screenings, chronic diseases, pediatrics, preventative visits, and even COVID, which was very relevant a couple of years back and still relevant, and then send the messages using CareMessage. But as Nora also said, these set it and forget it campaigns are set to address population health needs, fill gaps in care, and demonstrate improved health outcomes. But with the integrations, you'll be able to monitor the actual messages and any specific responses in CareMessage, and then view all of the program's performances in Azara. If you want to go to the next slide, where I am happy, as they've already introduced themselves, but happy to highlight two of our customers, our health centers, who really take full advantage of this Azara patient outreach integration with CareMessage, one being Greater Rosendale Medical and Dental Center, and one being Care South Carolina. And before I hand it over to Keita, just wanted to quickly call out some of the work they've done, trying to put some numbers to some of the messages that have been being sent out. Greater Rosendale has been sending lots of messages. You can see within the last 30 days, about a little over 16,000 patients have been messaged, about 15,000 of those specifically through the Azara patient outreach integration. But also that they've sent a little over 26,500 messages overall. 27,000 of those being through Azara. Of course, Azara patient outreach is a very large feature for them, but also they have a couple other integrations, the appointment reminder integrations, fueling to some of those other messages as well. But without further ado, I'll hand it over to Kita Kasapi, the Population Health Manager at Greater Rosendale, to tell a little bit more about how they're utilizing CareMessage and the APO integration.
Thank you, Stephen. If we can move to the next slide. As Stephen mentioned, we do use a lot of CareMessage, and I was just looking through the Azara on the slide previously. I think we use all of their campaigns except for the hypertension BP ones, which I just realized we don't, so it's going to be next one in enrolling. We have a very small staff on our population health team. It's only 3 of us, right? And we were newly created, so it was a challenge for us trying to outreach and make calls for all of our patients. And we were looking through methods with the leadership team, identifying what tools can we use to actually minimize the efforts of the team to having to call, and then benefit from outreach, text message campaigns, or anything that might have been available out there. We're very happy when we heard about the Azara. Initially, we were in those time we had just launched CareMessage for our patient reminder appointment. So it was, oh yes, definitely. We do use Azara a lot on our pop health team as well. So we started initially with a couple of campaigns, see how that went through for 5-6 months, and then we saw that it was actually working and it was impacting the health outcome of the patient. So we expanded more and more campaigns as we made sure that the mapping on the Azara side has to be always correct, and you have to keep updated on that end. Otherwise, you're going to have messaging going out to patients who are actually not due. So as you can see from the slides, it's mainly like a few of the uses, because we do use CareMessage a lot, but a few of the use that we do for CareMessage, aside from scheduling, reminding appointments, it's we used it for research enrollment campaigns for the past 2.5 years. We do a few campaigns, which is diabetes. There is an HPV research campaign. There is mental health, a couple of mental health campaigns that we're doing as well. So we benefited from the use of CareMessage, just exporting qualified patients that would be valuable candidates for the campaigns, enroll them in campaigns, send out text messaging to see if patients actually were interested in being part of a campaign. Simultaneously, we had our providers refer patient, but that piece is very low numbers yielding compared to the one that you get with outreach messaging, because you introduce the patient to what's available out there and they're like, oh, this is an opportunity, if they're interested or no, and then you pull back their answers, whoever is interested, yes, and then we just refer, so we don't have to do any extra steps. So that was very efficient, and those campaigns are all still ongoing, and we do that quarterly to make sure that we capture new patients and they enter qualified. Another way that we use is, like I mentioned, the APO campaigns. I mentioned a few of them in there. We definitely, like I said, we use almost all of them. They are very helpful. We tend to get feedback from time to time from providers letting us know, oh, this patient just told me that we got this messaging. And even though we updated our providers, but this in the beginning when we enrolled and launched the campaigns, the staff changes and sometimes they just forget. They're like, oh, what's going on with this? And then we're like, oh my God, this is so cool. We wonder how you guys are actually being able to manage all of the calls. So that's one other use that we do with CareMessage, which yields really good numbers. And in another slide that we're going to share an example of how that has impacted one of our campaigns. We did use it a lot during COVID by doing different campaigns for group eligibility. So as COVID age eligibility vaccination expanded, we would outreach our patients via MyChart was one, but not all of the patients have MyChart. And when you think about like third age population, right, they're not as tech savvy when it comes to all of these applications, and text messaging, it's actually one of the easiest thing to communicate with them. So we did use that, as well as more boosters became available, we expanded and just notified our patient and provide them the ability to come in and get their boosters and also like make appointments. Going back to the APO campaign, I love the fact We love the fact that you give patients options and you can actually identify if they're up to date with something. With, let's say, when we do diabetes campaign and you say, oh, we see that you haven't called us back, it's one of the follow-up, because you can customize those as you need. And we're trying to identify the reason why. And one of them is like transferred care or done elsewhere. So we don't have to call the patient, because the call is okay to be done sometimes, but then you don't get the patient on the phone, right? So you have to do all of this trying to catch, which doesn't really work most of the time. And then we can just, oh, patient had it done, so we can just go in and look for the result instead of calling the patient and trying to figure that piece out. The last thing is the one-on-one messaging, also like group messaging, which is something that we drafted and talked about it recently a lot with our team, try and alternate options for a lot of our outreaches, and some of them are successful, but what's not successful, even for like measures such as cancer screenings, for example, we're trying, going back to what I said, you play catch-in with patients and it doesn't work all the time. And we were drafting, we were thinking, like, oh, how can we actually use CareMessage for it? And going back to the team, we're like, oh, actually, we're going to pull patients based on wherever the referrals are sent, because they already know that they got those referrals in. So now we can group them, all patients who go to one specific location referrals, just provide them the location, the address number, the phone number to call, so they can actually make appointment and then follow back after to see what happened if that appointment was made, instead of us calling all of these patients and asking them to call back to provide those informations once it's done. There's a lot of ideas going on with the one-on-one messaging and group messaging, and then we just started actually using some of those. And well, we're hoping and we're very optimistic of the results. We'll keep you posted as it goes on the further. But without going too much longer, information about open referrals and numbers, contacts, screening, do reminder, text alerts is another option. As mentioned, as long as you have drives Azara, as you saw on the other slide, right? You have drives Azara and your mapping is correct, updated, then you can just pull those patients lists and send those reminders to them that screening are due. We used it last year. I'm not sure if we were the first health center to do it. I think it was 2 years ago, actually, sometimes a year and a half too now. We were doing monthly awareness cancer screenings. We started with cancer screening, and then we expanded it to all monthly awareness, just pulling groups of patients who would qualify in that group page for the month of, like this month was colorectal cancer screening, right? So we grouped all patients, and then we did a general messaging, not just going towards our patient, but like also community, because as a health center, we have a lot of patients who came to us during COVID time for vaccinations and for COVID testing, and some of those do still come, right? But we do not include them in our messaging for other campaigns. But when it comes to like awareness month, we do. And then in the text, there is something similar like to a patient or any family member that could benefit from it. So just sharing that awareness and sharing that information and letting community out there, because it's not just about our patients, it's also about the community that we serve, that this is this awareness month, and these are the risks, these are the benefits, and try to have them engage in their care, even though their care is not within our health center. We want a healthier population, regardless if they come to our health center or not. And we can move on to the next slide. I do tend to talk a lot. We are very passionate and we love CareMessage. So this is just a slide to show how CareMessage has actually impacted one of our campaigns along with Drives Azara. And this was for the diabetes campaign, reminder for patients who did not have an appointment, without an appointment reminder. And you can see actually the care gap closure rate that is from trailing year of March 22 to March of this year, 2023. And as you can see, it's like a 59% closure rate, which is amazing. We are proud to say that we are very adamant about A1C and compliance as a health center. But as mentioned earlier, our team is very small. And we had a lot of challenging last year. So we were left to 1 and 2 people, 1.5 people with resources. So it was very hard for us, and the campaign have made a drastic impact in closing gaps for our patients. We had only done some calls outreach for one of our contracts, which is the payer BACO contracts, but that's about it. Everything else, it's kudos to the Azara APO campaign, as you can see. So highly recommend it. As I said, it's very important to working closely with the Azara team to make sure that mapping is correct and up to date. But once that is sorted, it's tons of benefit on the patient's outcome. Also like on us as a health center, so we can actually focus. We do so many more things now versus just doing calls, because I feel like our team initially was just making calls 24/7, like all those 8 hours every day of the week was mainly calls. So now we don't do as many calls at all, very few.
That's great, Kia. And thank you. Really appreciate all of that. It's great to hear. One quick question. I know you mentioned from the start that you're a lean team of 3 and sometimes less than. I guess my only question, I'm sure a couple other people are wondering, how has it been managing between Azara and CareMessage with a very small team? Is it manageable? Obviously, it saved a lot of time, but just transparently, is it something that you can continue to do?
Oh, yes, absolutely. I mean, compared to what we were doing prior and all of the calls, and to be honest, I'm the only person on my team that actually keep a track to see what's going on, because I want the team members to explore and do other things within the population health and our health center instead of like looking at reporting. What I forgot to mention is Azara makes it very easy for you, also CareMessage, to track your campaigns, because there is a designated report slot that you can go in and you can pull in. If you have the APO campaigns, you can see successful messaging sent out. You can see messages who were not successful, in case you want to follow up on those patients' cases and see if you identify the root cause. What was it? Was it the wrong phone number? There can be many various reasons why the messaging did not go out, right? So if you want to get into those nitty-gritties, you can do that. You have the upcoming appointments. You can see how many more and what is the panel expected to be expecting this campaign messaging as well. But what I do love, which Azara does not have, that's where Azara complements and CareMessage complement each other, is like once you log into CareMessage, you right away they flag you those off responding, right? In a text message campaign, we say option A, B, and C, and then I opened one the other day, right? And as soon as I got in, and it said, I don't remember the flag, but it's the first thing, and it says not error message. I'm sorry, it's not coming to my mind right now. And I clicked in, and the response of the patient was like, it was regarding a fit camp testing, and the patient was like, oh, just dropped it off, but they did not actually clicked one of the options, but they just sent their own answer. And it's like, oh, okay, this is off. So you can actually go in to see if there is something that you have to follow up, or is something that we need to make sure. And also, like, you can pull from the patient's answers, right? So if, let's say, as an option D, I had, for one of the campaigns, we had childhood immunization, I believe. Option D, would you like to be outreached by one of our staff members to make an appointment? Because sometimes it's very hard for patients to get through the call centers or health center staff member through the phone to make an appointment in real time, because there is a wait line, or their time does not work with compared to what they have available, right? They call, they didn't get somebody talking to them in real time at the moment, and they just hang up because they have to go back to work, or they forget later on, right? So we can pull those options, those responses, and you can outreach on your end for those patients, also like asking what would be the best time, or all of these nitty gritties that are actually very helpful for the outcome at the end.
Awesome. Thank you. Thanks so much, Kita. Always appreciate all of the insight. I think that wraps everything up with Greater Roslindale, and very similar to what we did earlier, before I hand it over to Randy, just highlighting one of our other, both Azara and our powerful users and utilizers of both platforms, is Care South Carolina, who is our FQHC is located throughout South Carolina. They've been with CareMessage for what seems to feel forever, but since 2015, so going on a while now. But through that, just within the last 30 days, as you can see, similar to what we did on the previous slide, they've messaged about 23,000 patients, about 22,000 of that being through Azara patient outreach. And then all of those messages kind of accumulate to about 28,000 total messages sent, about 27 of those coming through Azara as well. Very easy to see that they are a very high utilizer of the Azara patient outreach and CareMessage integration. But also wanted to call out there, I know Dr. Angelosi mentioned a little bit more about some of the health education programs, a very high utilizer of the programs as well. You can see that with their maternal health programs, that there is actually an 86% completion rate, which is a fun little fact that out of all the patients messaged, 86% of them actually completed that program. But again, without further ado, happy to hand it over to Randy Carlisle, the Chief Quality Officer over at Care South Carolina. Hey, Randy.
Hey, well, thanks, Stephen. I want to talk a little bit about this slide, and then we'll go to another slide. But to kind of give you a grasp of that, which this is good to show the last month, but in 2022, we sent out 359,000 messages through the APO. And so far this year, we've done 116,000 messages. So the beauty of APO that I personally like is you can, to borrow a catchphrase, you can set it and forget it. And so basically this is running every day in the background. You get email updates to know which programs went out that day and how many patients were sent messages, which is extremely useful to know as a reminder that, hey, the system's working and, hey, it's sending the data out. One of the things that I wanted to mention too, as far as gap closure, which of course Keita mentioned, last year we closed over 11,000 gaps using APO. And those cover patients getting referrals, that covers patients getting their diabetic appointment. Whatever the APO messaging systems were, we closed over 11,000 gaps. And so that kind of led us to, we keep a monthly performance improvement scorecard. We have 26 measures on the scorecard, and all the UDS measures, of course, are on the scorecard. And we set internal goals based on each measure as to what we want to meet internally. And so this year was our best year in quality. We met 21 out of 26 measures, which was 81% compliance to our scorecard. Now, that's not 81% compliant with national goals for every measure, but our internal goals were met. And so some of the measures, we have some huge populations. We have 36,000 patients total. We have over 13,000 of our patients have hypertension. So over a third of our patient load has high blood pressure. So that is certainly a huge group. And then as far as diabetic patients, we have over 6,000 patients with diabetes. And so our patient, we're in the upper part of the northeast corner of South Carolina, and we have a high incidence of diabetes and hypertension. So that's where we do a lot of our focus at. But we were delighted, and I attribute a lot of that success to the APO messaging because it has allowed us to do things that we could not have done with people. I mean, we don't have enough people to call, all these patients and remind them to come in and get these screenings and get their cancer screenings, the breast, cervical, colon. We just don't have the manpower. And of course, CareMessage is so automated, and that's one of the beauties of it is it just, like I said, you kind of set it and forget it. As far as the programs, yes, I did want to mention that we have had a really good success rate with our OB population. We have one OB center. And so the way that process works is the nurse at that site, every week when they get a new OB, at the end of the week, she emails me those patients' names, and dates of birth so we can look them up. And then we load those patients into CareMessage every week. And so if we have a week that we don't have a patient, then there's no upload. But I attribute that of getting the patients enrolled early as soon as possible once they, come to see us. And like I said, we've had a huge success rate. And we've had some patients that didn't want to do it, but we've had the majority of them that wanted to do it. And of course, going through, think about a pregnancy going 9 months and to go through all the programs that CareMessage offers for the different trimesters. That's a lot of engagement when you think about a patient getting text messages once or twice a week and responding, because this is an interactive program for where the patient chooses what they ask questions, and you, depending on your choices, the algorithm sends them other messages and other resources. And so to have patients engaged like that is really huge. And of course, we feel like it's a great patient education piece. And again, it's happening without our staff time. The patient's coming in and being seen, but this education is going on at night, during the day. These messages are happening kind of around the clock whenever they get time to answer them. And that's the beauty of it. We also have programs running for our diabetic patients and our hypertension patients. And of course, we've got really good compliance there as far as the numbers. We have such huge numbers with that. You want to go to that slide, Stephen? I think we have one slide. This was something that we did that was kind of interesting. We had in South Carolina, all the Medicare plans and Medicaid plans are managed. And so United Healthcare, which is one of our Medicare providers, we have monthly calls with them, and they had heard about CareMessage, and they had a problem with patients not getting their refills every 30 days. And so they contacted us last fall and reached out and said, hey, would there be a possibility that you could, send a message to these patients from time to time, letting them know, because we don't have a way to text these folks. And I said, well, sure. Send me the list. And so they got the list built. They put it in a spreadsheet that is the format we needed to upload it. And of course, they send this securely to our population health team. And then the population health team emails it to me, and then we get it loaded. And they actually gave me kind of the verbiage of what they wanted the message to kind of say. And so, of course, I just simply went into CareMessage and kind of typed it in and made sure that it fit within the span of characters. And then I did the old Google search and went and translated it into Spanish and put that in. And then, of course, we do this now about every 2 to 3 weeks. They'll send a group, and the groups usually aren't huge. They're like anywhere from 30 to 50 to 70 patients. And so then we run it, and of course I set it to go out that day, pretty quick. And then I go back in and I download the report, and the report tells them, or tells us and them, which patients of that group got the message. And so it's really useful to give them some idea of knowing that this outreach is actually being read and looked at by the patient. And so it's kind of been a win-win for both of us, because yes, do we have to do this? No, but we're doing it because it helps us take care of these patients if they're taking their meds, picking up their prescriptions every month. Plus, as far as the measures with the plans, it's a measure that they're tracking statewide and nationally to make sure that these patients with Medicare are getting these prescriptions picked up. So we think it's a real win-win, and they've been real happy with it. We've been real happy with it. And of course, when you keep your managed Medicare plans happy, everybody's happy, right? Okay, so that kind of works out good for us. But we've been doing this now since November, and of course, it's been working well. And we're really excited to use and hope that APO continues and expands to other programs, because like I said, I think we've got every APO program that's out there is running. And of course, you can see from the numbers, there's a lot of messages going out every day, but the fact of the matter is it's affecting our quality in a positive way. And of course, that's the bottom line for us, is we want to get these patients where they need to be, and we want to meet these guidelines and measures that the plans put out and that UDS from the feds are putting out. And we feel like it's been a win-win for us, and we're just delighted to be using the product.
That's all great, Randy. Thank you so much. Thanks for sharing that. All the utilization of APO plus what you're doing with United Healthcare is great. I mean, that partnership is fantastic, with UHC having the fill data, sending it over to you, making sure that giving you the ability to send them those messages out to the patients who are overdue. Randy obviously using CareMessage as a communication mode that, of course, United Healthcare does not have. So love the innovation there, and hopefully you can be the start of a whole new use case for other health centers around the country. So thank you so much, Randy. Both Keita, Randy, thank you again. Cannot thank you both enough. But I'll pass it over back to Nora to continue on with some of the final slides.
Great. Thanks, Stephen. And thank you, Randy and Kita. That was awesome to hear. Always so honestly, one of my favorite parts of my job to hear about how our customers are using our platform in really innovative and different ways. It's really flexible to tailor messaging to meet the needs that you have. So hopefully this presentation helped to illustrate some of the benefits, not only of Azara patient outreach, but also of the CareMessage full platform and what you can do with it. I hate to do kind of checklists of features, but we get a lot of questions about, what does CareMessage do versus what does APO do? So this is a rundown, but even actually as Randy and Kita were presenting, I was reminded that, they have such a great relationship with Stephen. And part of that is because our customer success team at CareMessage works to build relationships with our customers and make sure that their needs are being met and brainstorm about how the platform can help them to communicate with patients to achieve their goals. We have a customer care hour every other week where we dive into specific monthly topics on how to use CareMessage to improve your patient engagement, and our customer success team is an awesome resource to our customers to help to really make your patient engagement strategy more robust. So we have just an overview of pricing here for the CareMessage platform plus Azara patient outreach. We, as I mentioned, are a nonprofit organization. We work directly with our customers to ensure that the pricing that we offer is tailored to getting them to more effectively outreach to more patients and help to achieve our mission of improving health outcomes for their patients. So we really try to make sure that our customers have access to do as much messaging as they want to and as they can. We also have great conversations ongoing with many PCAs and HCCNs and agreements in place that can help to offer discounts as well. I think that customers are often surprised that the investment for CareMessage plus APO is not a tremendous additive cost. So you can accomplish a lot more with a relatively small additional investment. But certainly if you'd like to discuss that more, contact our team. You can drop your email in the chat. You can send an email to hello@caremessage.org. We would love to talk more about how we can help you with your patient engagement efforts. So thank you so much for attending. I don't know, I think we have maybe 3 minutes left for any burning questions that anyone has. I'll look in the chat here. Don't see any. I'm very bad at just being quiet and not talking, but I will try for a moment so anyone else can throw anything out there. All right, I'm going to take the silence as that we have blown everyone away with what we've presented, and you are stunned and hopefully digesting. So thank you so much for attending. Thank you again, Kita and Randy, for being here. Thank you, CareMessage team. Thank you, Azara team. And everyone have a great day.